Okay, today we had a question from one of our core group members of the SEO group. And here I am in my WordPress interface for drleads.com. And let me go to the actual homepage. So the question was, if we decide to do blog posts on our blog, or on our website, how often should a blog be written and what is the minimum word length? And another question that I was asked by another member at one point was, where exactly does a blog post go? Um, on my website, we have a menu item up here for a blog, and if you click on it, it goes to a blog page. And here you can look them up by date. I don't think this is the greatest system. I kind of wish we had like a directory. I may update this because I've seen that before. We have like kind of a dense thing of links of like titles going way back. I'd like to probably have like my best blog posts of like, if I have like say 50 to 100 really good ones out of the hundreds that are on the website, I'd probably like to have them all listed here on the side column. So that I may do in the future. Um, so where do you go to do a blog post? Well, there's a few places you can look. This is WordPress. So WordPress was originally a blogging platform. Blog being short for weblog, which is like an online diary that you're sharing with the world. Um, if we go up here, you can add new media, a new page, a new post. A post is a blog post. A page would be like a service for like your business, for a doctor. Say you're a dermatologist and you do laser hair removal, you would have a page for laser hair removal. Um, if you're a like an addiction doctor, we do Suboxone treatment, we do alcohol treatment, alcohol detox. There would be a page for each thing that you do, like a service page. So if I want to do a new blog post, I could just go right up here, new, and then post, and that would. But let me show you another place. If we go to the dashboard, yeah, here. So you have posts. I can look at all my posts here. They have add new right there. Same with pages. Um, so yeah, WordPress originally was a blog platform. So the post, this has been here since the beginning, and pages maybe also since the beginning. But this is more for like a website, a web page. Um, so a website has pages which they call evergreen, things that don't change very often, saying, this is what my business does. Here's my home page. Here's a page about some stuff that we do in our business. Here's a contact page, things that don't change very often. That's why they call them evergreen. And a post is kind of like a diary or a news feed, like here's what's happening this week. Here's like a new article, a new topic, a question somebody asked that we're going to answer. So that's what a post is. That's where your blog is. A post is a blog post. So here's like all my recent ones going back. So there's a lot of them. This is all. So now we're back into last year. I should probably write blogs for this website more often. There's some months where I only did like one or two or a couple, um, one or two, three or four or whatever. So how often should you blog? Uh, I'd say ideally once a week. Some people might say minimum once a month. I think less than once a month is too rare. You should be doing it at least once a month. I think weekly is ideal. Some people might say two or three times a week. Um, if you're able to write 2 to 3 times a week. Now some people say if you write a lot of blog posts and you have like say you have 10 articles that you want to put up. I don't know if I would put up 10 at a time, but say I write a blog post, and I do call them articles interchangeably, but say that I put a blog post up and the next day I get a great idea. Some people would say like, well, time it, set it to publish like in a week. If you're going to do it weekly, do it the same day, same time, make it like a television program. People can expect to see your new blog post at a certain day and time. I don't totally agree with that because I'd like to have Google index it as soon as possible. So, if I come up with an idea the next day, I'll put it up the next day. Um, so anyway, you can add a new post here. Here's another place. So we have like three places. We can do it here. We could do it here. we could put a new one from here. And I think we had another thing here. Like here you can do this. There should, yeah, menu pops out here. So there's a few different areas we can add a new blog post. So let's do that. Let's add a new post. And I usually write in a different editor. I don't usually normally write within WordPress itself, but sometimes I do. You have to kind of worry about, like, if this page gets shut down, I could possibly lose my work. It doesn't necessarily always autosave, although I think it might autosave in some, I don't know, I wouldn't count on WordPress to autosave my text. But let's just make one up here. I call this is ketamine covered by insurance for depression treatment. Okay, so look at the characters. They recommend here up to 75. I usually try to get close to 75. I usually try to include really good keyword phrases in my title, but I'm not going to worry about that for this one. So how long should a blog post be? That was part of the question. So we know where the blog post goes, at least in WordPress. I think Wix is similar. They have a similar setup. They've copied WordPress a lot. Most platforms would have a thing saying, here's where the blog is, here's where you put a new blog post. But at least in WordPress, we know where to put the blog post. And we know that a blog post should be done at least once a month. Probably every week is a good idea. And okay, so how long should it be? They used to say 300 words minimum. I would say now probably the rule of thumb is at least 400 words, but ideally at least 600. And there's some people that say every blog post should be 2,000 words or more. And then a lot of those people went back on that and said, well, not every one should be 2,000 or more. Some should be, if you have a topic that has a lot of information to be covered, those should be over 2,000 words, and but don't pad it to make it 2,000 or more. My blog posts usually end up being around 1,000, 1,200 lately. For a while, I was trying to get everything to be 2,000 or more words, but it's pretty easy. Once you get into the habit of writing, to easily hit 800 to 1,000, and then usually by the time you're done, you're around 1,200. But if you can do at least 400 words, so let's aim for 400 now. Is ketamine. So you always want to start with, this is our title, which will come out as what they call an H1 title. And here we can set these headings: H1, H2, H3, H4. Within the body, I would only use H2 for my headers right now. So usually we'll make them questions. Is ketamine treatment ever covered by health insurance? And then we'll turn that into a header in H2. We could put health insurance up here. The answer to this question is yes and no. In certain So I usually do short paragraphs, like 1 or 2 sentences, sometimes 3. Like here, they look like really short sentences, so I might add a third for this paragraph. Okay, so there's our first paragraph. So is ketamine, yes. approved for medical for over 50 years. The original was for use as an anesthetic for surgery, other medical procedures. Fortunately, doctors are able to use ketamine for other uses, such as to treat depression, anxiety, OCD, PTSD, suicidality, drug addiction. I don't know if I should really put the whole list of stuff here. Drug addiction, alcohol addiction, chronic pain, neuropathic pain, bipolar disorder, migraines, and more. The use of the drug, let's change that. So we're at 122 words so far. When the drug is used for purposes that are not approved, call it off-label use. The problem with insurance coverage for ketamine IV infusion therapy is that being off-label, it is for these many different, being off-label, it is not FDA approved. I don't know if that sentence sounds right. The problem with insurance coverage for ketamine IV infusion therapy for these many different conditions is that being off-label, it is not FDA approved for these uses. Okay, I guess it's okay. Usually you don't want to have your sentences too long in a blog post. So we're almost at 200 words. That's good. Problem with insurance coverage. Yet there is a way to get ketamine therapy covered by insurance for the treatment of depression. Okay, almost at 200 words. As ketamine is an isomer of ketamine, the left. So if you're reading this and thinking, "Oh, we've already written all this stuff on our blog," well, have you written? I mean, you can repeat information on your blog, but have you ever written under this topic? Is ketamine covered by health insurance for depression treatment? Maybe you have. Maybe we could change the topic a little bit if it's something that seems like you've already written it, because you don't want to compete with yourself for a topic. I mean, I've written all this information before that's in the body of the blog post, but I haven't really covered the topic. Is it covered by health insurance? Okay, it is a left-handed form of the molecule. racemic ketamine. I always think that thing that's confusing to people that don't know about medications, calling it racemic, but I'll just leave it in. Um, okay, so we're over 200 words now. So the brand name for esketamine is, what do you call this stuff? Spravato. Since Spravato is FDA approved for treating depression, many health insurance companies do cover it. Oh, this is going to be a header. Okay, so if we were just aiming for 300 words, we're almost there, but I really feel like we should hit at least a minimum of 400. So yeah, when you're first starting this, even now, just doing this off the top of my head, it does feel like it's kind of like a stretch to get to. Um, okay, the brand name. Okay. Is not approved for other conditions such as anxiety, OCD, PTSD, or the other many conditions that IV ketamine be used for off-label. Doctors who administer Spravato do so under strict regulations and must only use it for treatment resistant depression. Okay, that's oh look, we're almost to 300. How does Spravato differ from IV ketamine? The nasal spray. IV ketamine infusion, on the other hand, is often administered several times weekly for around 6 to 8 sessions, where Spravato is given indefinite. Continue treating depression. IV ketamine is considered to have lasting effects, so the patient does not need to return for IV infusions on a regular basis after they have completed the initial series. Okay, so we're almost at 400. Should I get Spravato, esketamine therapy, since my insurance covers it? If you are considering, see, now we're kind of on a roll, so I feel like I'll hit 400 easily now. Ketamine assisted therapy. About I try to mix up these different things like Spravato therapy, Spravato treatment, um, ketamine treatment, ketamine therapy, ketamine infusion, ketamine IV infusion, different variations. I don't know if it helps, but it seems like it's good for keyword variation. See, we're already over 400. Um, However, insurance coverage should not be the only deciding factor for committing to a particular medical treatment. Benefit more from ketamine infusion. I don't know if I did this one yet. Ketamine IV. If you decide you would benefit more from ketamine IV infusion therapy over Spravato nasal spray therapy, the treatment, or you may also want to price shop in your area. See, I can write this because I don't have a ketamine clinic. If it was your clinic, you probably wouldn't want to in any way suggest that people look around and shop for prices and whatever. Okay. Sure that the clinic the ketamine clinic, I should use that word, ketamine clinic you go to includes psychotherapy and integration therapy. See, and then I could go into what is integration therapy a little bit as part of the program. There are a variety of I don't want to get into too much here. Make certain that the ketamine facility that you choose is properly credentialed and highly rated, whatever that means. Price should not be your only deciding factor, just like insurance coverage shouldn't be. And of course, it's always good to say talk to your doctor. If you are considering, oh, I already wrote that. When you have decided to look, see, I'm almost at 600 words now, into ketamine therapy as a solution for depression or other conditions, it is a good idea to speak with your primary care doctor. Ask your doctor if they think that ketamine treatment might be a good idea to help with treatment resistant depression. Okay, so there's a blog post, and we're not quite at 600 words, but we did go past the 400. So you can see, like, once you get into a rhythm of writing and writing on a topic, at some point it gets easy to keep going. At first it seems like a struggle, like at certain points, but then you just get on a roll and you're like, wow, I can just keep going. I don't know if tags really make a difference. Some people want to put every keyword in the world under their tags, but insurance coverage for ketamine, ketamine covered by insurance. I probably would add I usually add like 4 or 5 tags at least. I think I put ketamine here already for my category. Usually I put a featured image here. Um, I think for this I'm just going to finish here. I'm just going to save it as a draft and not publish it. Actually, let's just look for an image. Okay, so I usually use this stencil. Oh, there's me. This size is for like a blog post. Let's see. Yeah, I usually do 1200 by 600, and I'm not going to use me. Okay, what would fit with is ketamine covered by health insurance? Let's just look for. It's probably not going to be anything good here. We could probably use some of these. Wait, let me get rid of me on the front of that. Yeah, it could be like the patient researching online, is this covered by my insurance or not? Okay, let's just go with that. Let's call it does health insurance cover ketamine? And I usually do compression to make the picture smaller. Takes a little bit extra time. And okay, so let's start working over here. Let's just put some other stuff here. Okay, let's set our featured image. Okay, and then these meta tags, usually you would have Yoast, Y-O-S-T. I have this other alternative thing that gives me access to the meta title and meta description. I usually just repeat the title for that title. So do that. I like to do the Twitter card. I don't know if I'm even posting to Twitter anymore, really. We'll use the same image. I usually like to make it the big one. Same title again. Let's figure out something we can use. I'll just go with this paragraph. It's not that important. Oh, this is important because this is the thing people will see when they search on Google and you come up in a search. They're going to see that for the title and that for the little blurb under the title. Okay. I think we pretty much did everything. Oh, it's good to have a link in here. A link to something. Usually when I have a link to something on your website and then something beyond your website to somebody else. Search for. See if we had ketamine as a therapy. Oh, I think I have ketamine consulting. Yeah, see, I don't have a ketamine clinic, but I'd be happy to do consulting work and talk to people about that. See, I have like a ketamine podcast up here. I don't know why I picked that one. Okay, so let's take that and we're going to link to that from our blog post. If your doctor is not prepared to discuss ketamine treatment with you, you may want to schedule a consultation appointment with a medical ketamine consultant. So then we highlight this. Here's how we do a link. I copied the link, the URL from the other page, and the other one was a page, not a post. That's this one. This is actually is a page. Which is similar. Pages and posts are not that different the way they're implemented in software. Okay, so we click here and then we put that as a link. You could go here, link options, if you want to open a new tab, but I'm just going to do it like a regular one without it changing anything. Okay, and okay, that's good to publish. So that didn't take too long. We're going to publish it and see how it looks on our blog. So we go to view post, and there's our blog post. It looks great. Okay, so that's it. Okay, thank you for watching.